What if you could make your EHR feel better without ripping it out? That's exactly where an EHR overlay comes in, and implementation is usually much simpler than people expect. Phase 1 is discovery. The team reviews your current EHR, maps daily tasks, and finds the biggest pain points, like too many clicks, slow charting, or scattered patient information. Phase 2 is setup and pilot. The overlay is connected to the existing system, configured for a small group, and tested in real workflows before anyone talks about a wider rollout. Next comes training and feedback. Staff learn the new interface, use it during live care, and share what works. That feedback helps fine-tune screens, steps, and support before expansion. Finally, the overlay rolls out in phases across more teams and locations. You measure adoption, speed, and satisfaction, then scale what works. Want more simple healthcare tech explainers? Like and subscribe.